So the habit that created the cancer was there. If you wanted to hate something, if you wanted to do something serious about your cancer, it should have been your habit. But you have the habit and the lifestyle that facilitated it. And now, what may just be the best option for you is not an option at all because of your ignorance. And that is the reason why the workshop that I'm planning is so important, because I want to give people real hope. Not to just say, oh, use this approach. Use that, and that is not to say that there are not some powerful herbs out there. That is not to say that there are some powerful options out there, because in our workshop, upcoming workshop, we're going to talk about those powerful options. Not telling anybody what to do, but that workshop is designed to give persons insights as to what are the options that maybe without this workshop they would be knowledgeable about, to bring to the table as they discuss their prognosis, as they discuss their recovery approach with their healthcare provider. That is not also to say that there are some medical doctors who are open to integrative approaches. There are some medical doctors who are open to natural therapies, and there are some that are not. Your health is your responsibility. Your oncologist or your doctor is trained and being paid by you to give you the best advice based on their training and their technical knowledge. Their job is not to decide for you. I know sometimes they appear that way. I know sometimes they talk with that level of authority. But their job is really to guide you. Your job is to be informed so that you can recommend some options, and then they can guide you. And because they take an oath to do no harm, then they should follow through on that. And of course, again, I said this is completely based on the preference of your healthcare provider. So they may choose not to, or there may be other factors that is not friendly towards them, because there's a lot of hostility to a number of options out there if it doesn't benefit Big Pharma. All right? So, leukemia, the acute lymphoblastic leukemia, is one of the cancers that are out there. Then there is what is called the chronic myelogenous leukemia. And chronic myelogenous leukemia, also known as chronic myeloid leukemia, is a cancer of the white blood cells. It is a form of leukemia characterized by the increased and unregulated growth of myeloid cells in the bone marrow and the accumulation of these cells in the blood. So that's another type of leukemia. And then there's what is called the acute myeloid leukemia. Acute myeloid leukemia is a cancer of the myeloid lining of blood cells, characterized by the rapid growth of abnormal cells that build up in the bone marrow and blood and interfere with normal blood cell production. As we look at these cancers, cancer families, as I said, we're looking at the 5 major families. These are the 5 major families. And there are some persons who the doctor will say that you have a rare type of cancer. What do you mean by that? A rare type of cancer is a cancer that sometimes cannot be fit into any known family structure, any known cancer classification system. So it's completely new. And I should say that what happened is that in time past, the diseases that were common to men were diseases that were based on bacteria or based on pathogens, natural diseases, bacteria, pathogens, and then to a lesser extent, hormonal imbalances or chemical imbalances in the body. But for the most part, bacteria and pathogens. The diseases that we're seeing now is the result of toxins, chemicals, poisons. In other words, as we advance as human beings are being exposed to more toxins and to a wider variety of toxins than humans used to be exposed to. And that is responsible for why there is a prevalence of cancer now. Because as we are exposed to more harmful chemicals, more harmful toxins, what happens is, and by the way, a lot of us don't live in the environment that is conducive for the body to heal itself. A lot of us lived in toxic environments, and we never talk about toxins. Most time we think about chemicals, but there's a new type of toxin that is affecting man, and that is going to affect human beings even more. That toxin is a toxin of radiation. We're talking about frequency radiation, because as we develop right now, we are advancing in an age where the amount of toxic radiation that we're exposed to is not just from cell towers. It's now from modems. It's now from multiple devices in our homes. It's also due to the fact that many of us don't interact with nature as we ought to. One of the therapy that was given to us as human beings is the frequency that we get from green plants. In other words, it is therapeutic just to walk barefoot in an environment where there's a lot of greenery. What this does is that the body is able to use that to naturally balance itself. So we are exposed to high levels of radiation, frequency radiation. The smarter the device is, the more radiation we are exposed to. Now we're talking about robots, we're talking about vehicles, we're talking about so many things. On average, the average human being, we are heading in a direction where the average human being will 100% of the time always be in physical contact with radiation that is harmful for the body. So when we're talking about cancer, we're talking about cancer becoming more prevalent. There are certain persons who have cancer who, one of the reasons why you can't heal is because your body's healing mechanism is damaged. It's damaged because the frequency that you are exposed to most of the time does not give the body any chance to recuperate or to recover. So we're not talking about taking substance. A lot of people want to talk about what herbs do I take, what foods. All of that is good, but sometimes what's required of you is leaving the environment that you are in that is conducive for cancer. We live in a world now where human beings are so artificial, or live in such an artificial setting, that to go into a natural environment, we are looked down upon. So what I'm saying is that as we look at the different families of cancer, one of the things that is essential, and as I'm trying not to go into the treatment plan, but it's almost impossible to talk about it and to some extent not jump around the periphery or the edges of the treatment options, because knowing about the families is designed to help you to choose the best option, the treatment options. It's real purpose why we're here tonight. The purpose of understanding the different families of cancer is to aid you in choosing, along with your healthcare provider, the best treatment option for you, the best treatment option for your mom, the best treatment option for your dad, the best treatment option for your son, your daughter, whoever is being affected. The reason why I'm talking about the families of cancer is to educate you so you can ask the right questions. So the next time you hear that you have cancer, the first thing that you should try to find out, let me see, what's the first thing you want to try to find out? Let me get some involvement in tonight's presentation. The minute you hear that a person has cancer, what's the first thing you need to find out? First thing you need to find out. And then there's the second thing you need to find out. Because most people don't know this. What's the first thing you need to find out? Come on, guys. Once you hear that somebody has cancer, the first thing you need to find out is what? Which family? Thank you, Cynthia. The first thing you need to know is which family. Jazzy Max said, do you smoke? No, not do you smoke. The first thing you need to find out is which family is this cancer from? Then, the second thing you need to know. What's the second thing you need to know? The second thing you need to know, these are two of the most important things you need. Family history, Joseph Max family. Cynthia B said where it is. No. One more person, where it is. No, that's not what you need to know. The first thing you need to know is which family it belongs to. The second thing you need to know is what stage is it? What stage is it? These two very important information helps you to determine what treatment plan. Now, treatment plan may mean one, and I'm going to talk about a treatment plan, but I'm not going to go into them. So the second thing you need to know is what stage. First thing, which family it belongs to. Second thing, what's the stage? How advanced is it? First two things you need to know. This is what you need to know to begin to build your treatment plan.